Hi, welcome to the Hill and Ponton video blog. I'm attorney Ann Linscott. I'm here with
attorney Melanie Williams.
And today we're going to be talking about traumatic brain injury, what that is medically, filing claims for it, and all the interesting and complex things that go along with that. So join us. All right, so Melanie has recently had a case involving TBI, traumatic brain injury issues. And so she is going to, it's fresh on her mind, and kind of guide us through what TBI is from a medical standpoint. And then I'll kind of join in with her explaining claim involving TBI, things like that. So Melanie, if you could go ahead and start with just kind of giving us, I guess, medical background, so to speak, as far as what TBI involved.
Yeah, of course. So TBI stands for traumatic brain injury. And basically, it's a head injury that disrupts the normal function of the brain. It's caused by an outside force. And so it's usually a bump to the head, a blow, or a jolt to the head. Sometimes there could be penetration of the head, like by a bullet, but it doesn't necessarily have to be that. So there's mild, moderate, and severe TBI. Mild TBI is also known as a concussion. So it's a brief change in mental status or consciousness. Usually there are short-term symptoms. They tend to appear right away. You could have loss of consciousness for a few seconds, or if not, if you don't lose consciousness, you may be in a state of daze or confusion, or you might be disoriented. Now, with all TBI, depending on the severity, there are 4 categories of symptoms. There's usually cognitive, physical, sensory, and mood or emotional symptoms. So for cognitive, you can have amnesia, inability to speak or understand language, confusion, difficulty concentrating, thinking and understanding, remembering new information, inability to recognize common things. And again, all of these, you could have all of them, some of them, or they could be other symptoms like physical symptoms, headaches, nausea or vomiting, balance problems, dizziness, fatigue, instability or stiff muscles, sleeping more or less than usual, or trouble falling asleep. Sensory symptoms that are also really common are blurry vision, sensitivity to noise or light, ringing in the ears, loss of smell, and of course, mood problems. So anxiety, depression, irritability, impulsivity. These could all show up right away, or it could take some time, so a few hours or a few days later. And then usually if the effects are long-term or lifelong effects, this is known as severe TBI. So there could be an extended period of unconsciousness or amnesia, but really it's just a matter of the severity of the symptoms and when they appear and for how long.
You read my mind when you talked about when the symptoms might happen. So sometimes they can happen pretty much at the same time as the event or the accident, and other times symptoms might show up later.
Yes, exactly. And a lot of times the symptoms that happen right away, that's what's going to help determine, for a doctor to determine if the TBI happens. So like if you don't get treatment right away, but then other people notice you acting strangely and stuff, and that could then show later that you were experiencing a TBI at the time.
I'll get more into how that could be helpful too. So with all of those symptoms, I know when things happen in service versus after service, as symptoms change or as they develop, what kind of treatment do you usually see as far as, would you expect to see certain treatment in service versus after service, or even just as it doesn't necessarily, relate specifically to claims, but just as far as helping someone who might have TBI and what kind of treatments are out there?
Yeah, that's a good question. The first thing is going to be there are tests that doctors do to basically identify the effects of the TBI. So neuropsychological or neurocognitive tests. Medication is for each of the individual symptoms is helpful. There is also surgery. It's called decompressive craniectomy surgery, and that's when they do a surgical removal of part of the skull so that the brain can swell without being squeezed, and that kind of helps alleviate the symptoms. And then, of course, there's also therapy. So rehabilitation, cognitive behavioral therapy, anger management, things like that to help you deal with the symptoms. And it's just going to depend on when the veteran notices the symptoms, asks their doctor about their symptoms, and then, the doctor could help the best treatment is at the time.
Right. You brought up a good point with sometimes with therapy. I know with TBI, and I'll get into this in a little bit, as far as the symptoms are almost, you can think of residual problems or, sometimes wholly separate diagnoses that are related to the TBI. And so it's not just about treating the brain sometimes, it's about treating the other problem with it. So
Exactly.
There's a lot out there.
And so there was this particular case that I had with TBI, but we have so many cases of TBI. It's something that, happens with veterans. It's common. So do you want to tell us about some of the potential causes that happen in the military?
Yeah. So like you said, it is very common. You'll hear it a lot referred to as kind of a characteristic of veterans from, the post 9/11 Iraq and Afghanistan wars because of the increased use of IEDs, improvised explosive devices. But technically, it's not just that group of veterans. There's an something in service that could cause TBI isn't just an explosive device. There could be a car accident, slip and fall. You see TBIs a lot, events that might happen in combat just because of the nature of combat. But technically speaking, just like when we talk about how, if you're on active duty and you're playing basketball and you injure your knee, you can still get service connection for your knee just because you're playing a game of basketball. You don't have to be doing a military related activity. And that's the same thing with TBI. So, it's definitely more prevalent in veterans from Iraq and Afghanistan because of just the way that the warfare has changed. Any kind of veteran can have it. And so, leisure activities, veterans and active duty military members. Physical training is definitely an important thing. So basically anything that happens in service, as long as, you weren't doing something that you weren't supposed to be doing as far as with drinking or drugs, things like that, which I have a tangent, but so that's a whole other thing. But if it happened during service and it involved, a traumatic injury to the brain, then that's going to be a cause. And I was actually looking through cases. There's, things can happen after service where something happens because of an already service-connected condition. If that results in some kind of traumatic injury to your brain, even if it doesn't happen in service, but it happens because of a service-connected condition, that could still be a cause.
That's a good point. So like if a veteran, for example, they have neuropathy in their feet and they can't feel their feet and they fall, and then that fall causes a TBI, again, assuming that the neuropathy is service-connected, that would be a way to get TBI service connected, right?
Exactly. And so that's something to look out for because, and I know that you'll be covering it, but TBI definitely can be severely disabling, have a lot of residual problems and lead to increased level of care that can get expensive. So if there's a way to relate it either to something that actually happened in service, like the IED blast, like a fall or an accident in service, or link it to something after service, then keep an open mind because, it might be a way to help take care of those increased medical expenses.
Yeah. So do you know how common TBI is among veterans?
So there's a couple studies that I looked at. There's it was a report done by the Defense and Veteran Brain Injury Center. Over 400,000 veterans were affected by TBI between the years 2000 and 2019. So I'm sure that number has grown over the past couple of years. And then as far as kind of comparing Iraq and Afghanistan veterans to other groups of veterans, such as Vietnam, there was a Department of Defense study that did some estimates in 2017, and they estimated that there's about 22% and I'm pretty sure it was just related to veterans who may have gotten TBI as a result of combat situations, but 22% of Iraq and Afghanistan veterans ended up with some kind of brain injury versus 12% of veterans from Vietnam kind of in similar circumstances. So like you said at the beginning, it's really common. It has definitely grown as far as how common it is in veterans. And that's definitely due to, one thing is this has a lot to do with any injury in service nowadays, but with technology comes, increased weaponry, things with more force. And then it's also veterans are coming back alive. And so we're getting more numbers from people who possibly in past wars, they might not have survived the injury that would have resulted in a TBI. And so those numbers are.
Yeah, that's a good point. And again, it's assuming that the veterans are able to recognize the symptom and report the
exactly.
So it could be a lot more.
Definitely. That's when I say estimate, it's a definite estimate. I mean, I would say if anything, that's probably on the low end of what possibly is out there.
Yeah.
I think typically you'll see people either underreporting or, it is a complex thing. You might think you have depression and headaches and not realize that it could be actually a TBI. And
so, okay, tell us a little bit about, you know that you have a TBI. What do you do if you want to get benefits? How do you service connect the TBI?
So as with any condition, service connection, you need the in-service incident, a current diagnosis, and then a link between those two things. You'll hear that called a nexus. So there's not any special rules as far as that goes with TBI. However, I would say TBI cases, it really becomes important to have some medical evidence. The in-service incident is something that you can have, the veteran can describe what happened in service, or maybe there's even just a service treatment note or something in there that shows something happened. It's not necessarily a doctor saying it. And that's enough to the diagnosis part. A veteran, you can describe your symptoms, or like you said earlier, you can have family or friends or someone that was there describe what kind of behaviors or physical symptoms they observed happen right after the event. Those symptoms and those reports can be used by a doctor to provide a diagnosis, but the veteran himself cannot provide the diagnosis. So that's where you need medical evidence. And then also that medical evidence saying that, yes, there's a current diagnosis of TBI, and here's why it is, at least as likely as not, a result of the incident service described by the veteran. So that's similar with any claim. That's the first kind of thing to do. You've got a service connections, kind of the first battle. You can't start arguing about ratings and other details until you get the service.
Right. Okay, so you file a claim for service connection. What is that going to look like? What can you expect when you file a claim? What kind of evidence is going to be helpful?
So you should definitely expect the VA will do their initial development. As with any claim, if they're missing any kind of evidence that they feel is needed to complete the claim, they're going to request that from you, whether it be service records, medical records. They may, and probably I'm willing to say pretty often, will schedule a veteran for a C&P exam for TBI, especially at the regional office level. They like their forms, the TBI evaluation to make sure that everything is met as far as diagnosis requirement. So that would be right off the bat as far as what you get the claim in. Obviously, if you have all the information or evidence that you feel completes your claim, submit it with the claim. It doesn't hurt to go ahead and do that. You don't have it all together, at the very least, just get that claim in, because that gets the ball rolling on it.
So I know I mentioned before all the different symptoms that can come with TBI. So you file your claim for TBI. Is it possible to get a secondary service connection for what would that look like?
So yeah, I like to think of, this is how it makes sense in my brain, which may or may not work for other people, but as you were going through the symptoms and problems associated with TBI, a lot of times can actually separate conditions in and of themselves, as far as they have a diagnosis, and their relation to service would be because they're caused by the TBI. And so that is technically secondary service connection. It's a condition that's caused by a condition that's already been service connected. So that's where, there's definitely some known residuals as far as conditions like Parkinson's, seizures, dementia, a lot of neurological issues. The VA will actually presume that to be related to the TBI, but regardless of whether it's something specifically listed as presumed to be conditions known to be caused by TBI, you can still get secondary service connection. So similar to how something after service could cause your TBI, if you had, neuropathy and fell, that could be something. If your TBI, if it results in seizures, and so that was something I just said could be secondary, and then you have a seizure, something else results from that, you just follow the link, the chain of events back to the initial diagnosis of TBI, and that can be secondarily service connected. So there's such a big range of possibilities that could happen with any condition and secondary service connection, but especially with TBI, because it's so complex. It involves so many different areas of the body, your brain, cognitive issues, like you said, physical issues, mental health issues. And so, if you're not sure, it definitely doesn't hurt to try and say, I think this is related to something else. As with proving direct service connection, you're going to a medical doctor to explain that something is secondary to the TBI or vice versa.
And I think it's important, like you said, these are completely different diseases or conditions, like the Parkinson's and the seizures, that results from the TBI. And that's separate from the residuals, which is what I'm going to talk about in a minute. And so those whole entirely separate conditions could be service connected secondary to the TBI.
Right. So sometimes with residuals, it's going to just factor into how the TBI is rated. Sometimes your residuals might actually be a whole separate condition that should be separately service connected for and separately rated. And that's kind of a perfect example for how extremely complicated these claims can be, because not only does the VA mess up the residual ratings and how the TBI is rated, but they'll, instead of rating something as secondary to the TBI, they kind of lump it in.
Right.
And so that's definitely something to look out for.
Yeah. So I think, kind of segueing into what a rating for TBI looks like. Rating TBI, it's a little complicated. The VA has 3 different categories of symptoms that they use to determine a rating. So there's cognitive, emotional / behavioral, and physical. And so I'm going to go through each one and go through how they determine the rating. Now, a doctor will have to evaluate these symptoms and the severity. And what they do is for each category, they assign either a 0, which means there's no problems, that the symptoms don't really affect you, or they'll assign a 1, a 2, or a 3. And each of these numbers corresponds with a different percentage. So if the highest number that they assign is a 3 in any of these categories, that equals a 70% rating. If the highest number they assign is a 2 in any of those categories, the rating that you'll get is a 40% rating. And if the highest number they assign is a 1, that's a 10% rating. Now, if under any of these categories that I'm about to mention, it's a total deficiency or total limitation, that's a 100% rating. So starting with the cognitive, they're going to look at decreased memory, concentration, attention, and executive functioning. So some examples of that are goal setting, processing information, planning, organizing, prioritizing, problem solving, judgment, decision making, spontaneity, flexibility, and changing actions. These are things that veterans probably don't even realize that they're having trouble with, but these are symptoms of TBI. And so, this is a good area where other people in your life might be able to, better talk about, hey, it seems like decision-making is really difficult for you, or things like that. So
I was going to say, these are all things where it's kind of hindsight's 2020. As things are happening, you might not think anything of it. Pretty common for veterans to maybe downplay what they're going through, but family members and friends, these are all things that they might know. And so really good, because a doctor is not going to be able to tell the veteran that, they notice that they have problems with this. That's where keeping track of your symptoms and knowing what's going on becomes really important.
When a doctor, just one meeting with you, they're not going to be able to tell everything. So you want to make sure that you're advocating for yourself, describing, all the different times that you have problems with these symptoms and things like that. So if a doctor determines that you have mild loss of any of the symptoms we just mentioned, they would assign a 1. So they're going to be looking at difficulty following conversations, recalling recent conversations, difficulty remembering names of new acquaintances, difficulty finding words, often misplacing items. And again, these are, things that you may not realize are happening, but they kind of happen to you every day. Now, these ratings can be based on what you describe or on objective testing. So if there is evidence of this impairment, there's objective evidence, and it's mild impairment, they assign a 2, and a 3 is going to be moderate impairment. So a lot of these, the terms are going to vary between mild, moderate, severe. Again, a total rating is severe impairment. And so each of these subjective terms are going to be for the doctor to decide whether it's mild, moderate, or severe. Again, they assign a 1, a 2, or a 3. If they assign a 3, that's an automatic 70% rating. Okay. The next category is judgment. So if you are occasionally unable to identify, understand, or weigh alternatives, understand consequences of choices, make a reasonable decision, those are the things that they're looking for. And if you're occasionally unable to do that, it's a 1. So that's mild impairment. If you're usually unable to do that, that's moderate impairment, they would assign a 2. A 3 is moderately severely impaired judgment. So like if you're unable to do these things for even routine and familiar decisions, that's a 3. And if you're severely impaired in your judgment, that's a total, that's a 100% rating. So an example of that would be you're unable to determine the proper clothing to wear for the current weather conditions, or you're unable to judge when to avoid dangerous situations or activities.
Or I know a lot of times the VA doesn't define words, and it kind of, that's, I guess lawyers love when a word isn't technically defined because it gives us the ability to argue. But
yes.
For the words occasionally and usually, is there something set in stone as far as occasionally means once a week, usually means 3 times a week, or is that something that veterans should kind of pay attention to as far as?
Yeah, exactly. They leave that open to interpretation. And so, and it's going to be the doctor determining what defines mild, occasional, moderate, usual.
They're just kind of the buzzwords.
Yeah, exactly.
Okay.
Exactly. It's what the doctor is going to interpret. And so that's why you want to be as specific and, talk as much about your symptoms as you can, because they're going to be the ones making that decision. Another thing, so the next category is social interaction. And again, we have, if the way that you interact is occasionally inappropriate, that's a 1. Frequently inappropriate, that's a 2. Inappropriate most or all of the time, that's a 3. Some examples of this might be, if you start laughing randomly at inappropriate situations, things like that, not really knowing how to, interact in social settings. The other category is orientation. So this is something where, doctors determine, are you oriented to person, time, place, and situation? So if you're occasionally disoriented, that's a 1. If you're occasionally disoriented, to 2 out of the 4. So out of the person, time, place, or situation. If it's 2 out of the 4, occasionally, that's a 2. And if it's often disoriented, to 2 of the 4, it's a 3. So I know that's kind of a lot. Can you think of any examples of being disoriented to time, place, or situation?
Can't remember if it was a TBI specific case, but I know there was one of our cases where the veteran would find himself driving, on the highway or something, and all of a sudden either completely forget where they were going or had no idea when to exit. I'm not a doctor. I don't know if that's medically disoriented, but I think things like that, if you find yourself kind of just not knowing where you're going, what you're out going to do, just having
time
kind of no
year.
sense. Exactly.
Sorry. Yeah,
so that's one that I can think. I can't remember if it was a mental health case, or Parkinson's, or it could have been all of the above and TBI or just TBI. But that example sticks out to me as far as, talking to the veteran, and he was explaining, I don't drive anymore because I get on the highway and all of a sudden I have no idea what exit is home. I have no idea why I got on the highway in the first place, that kind of thing.
Yeah, and that goes along right into the next category of symptoms, which is visual spatial orientation. So exactly that. If you get lost in unfamiliar surroundings, if you have difficulty reading maps or following directions, if this is only, if the impairment is mild, if you're still able to use a GPS, the doctor would assign a 1. If it's moderately impaired, so if you have difficulty also judging distances or difficulty using GPS, the doctor would assign a 2. And if you get lost even in familiar surroundings, like you mentioned, driving home, you drive home all the time, but you get lost or you're completely unable to use a GPS, they would then assign a 3. And so again, just to kind of, remind everybody, a 3 is a 70% rating, a 2 is a 40% rating, a 1 is a 10% rating. And they're going to be looking at, in all of these categories, what's the highest number that the doctor assigns between 1, 2, and 3.
You read my mind again, because I was just about to say, if it might be jumping ahead, I'm not sure, but say a veteran has, in a couple areas, 2s, and then only one area of residuals or symptoms are rated at a 3. Do you just need 1 3 to get a 70?
Yes.
Okay.
Yeah. And then going into some of the other symptoms, so they call them subjective symptoms. So like headaches, anxiety, dizziness, things like that. So if you have some of these symptoms, but they don't interfere with your work or with your activities of daily living or relationships, those are the 3 areas that they're going to be looking at: work, activities, relationships. If you have only mild or occasional headaches, they'll assign just a 0. If you have 3 or more symptoms, they'll assign a 1. And again, some more of symptoms that I forgot to mention: tinnitus, frequent insomnia, hypersensitivity to sound or light, marked fatigability, blurred or double vision. Again, if you have 3 or more and they mildly interfere, that's a 1. If you have 3 or more and they moderately interfere, that's a 2. And something that I also want to mention is that each of these categories have their own set of numbers. So like in this category, the highest that a doctor could assign is a 2. Don't ask me why. I don't know why they do it that way. That's just kind of what it is. And then we have neurobehavioral effects. So with that, we have irritability, impulsivity, unpredictability, lack of motivation, aggression, belligerence, apathy, moodiness, inflexibility, impaired awareness. If you have 1 or more of those and they occasionally interfere, that's a 1. If you have 1 or more of those and they frequently interfere, that's a 2. And if you have 1 or more of those that preclude your interaction or require supervision, that's a 3. And lastly, we have communication. So spoken language, written language, Are you able to communicate complex ideas? That's going to be a 1. If you have the inability to communicate more than occasionally, but less than half the time, that's a 2. And if you are unable to communicate at least half the time, but not all the time, that's a 3. I know it's a lot. It's very, very
I think the
specific.
overall theme of all of it is there's a lot of room for interpretation. And
Yes.
if you leave it up, I guess I try to always be a little more optimistic these days. If you leave it up to the VA, yeah, technically they might get it right, but leaving things up to the VA's interpretation is probably not something.
Right. And again, it's going to be based on the doctor's evaluation, the testing, they're talking to you. And so they do have to go through each of these categories. And so when you get a rating for TBI, you want to make sure that, you've looked through that CMP exam or you've talked to your doctor thoroughly to see, are you receiving the proper rating?
Yeah, because with lay evidence, like we were talking about, having family and friends describe symptoms, or a veteran describing their symptoms or what happened in service, all of that is helpful. But with TBI especially, it's so important to have some kind of treatment, be seeing some kind of doctor, because your family and friends.
Yeah, absolutely. And so even though, I went through all of these to get a different rating, but ultimately our goal is, if you are disabled, how do you get to 100%? So if the doctor doesn't indicate that any of those are total, total and complete impairment, that would be the first way to get to 100%. The second is through, a combined rating. So something that I forgot to mention, if any of those, well, not any of the symptoms, if the symptoms are severe enough to have their own separate rating, they should be rated separately. So like headaches is a good example. If it's mild and it falls into that category of 1, 2, or 3, that's where it's going to fall. But if you have headaches that are, migraine headaches that are severe enough to fall into the separate rating category of headaches. So like if they are, more than once a week, they're frequent, they're causing you trouble, being at work all the time, that would warrant a separate rating. Same thing with mood disturbances. If it's gotten to the point where your doctor has diagnosed you depression or anxiety, and it's severe enough to fall into the category of being rated for a separate mental health condition, you are entitled to a separate rating. So you would get a rating for the TBI, based on the 1, 2, or 3, 10, 40, or 70. And then separately, you'd get rated for the anxiety, depression, headaches, whatever the case may be.
So I think the mental health one is a good example, as far as, because so often mental health symptoms can kind of overlap with mental health diagnoses. So you'll hear someone say, "Oh, I'm so anxious." That doesn't necessarily mean they have a clinical diagnosis of anxiety. But
right.
In this case, if their feelings of worry and those symptoms actually meet the diagnostic criteria for anxiety, then they should have that separate rate.
Right. Like if that anxiety alone is causing occupational and social impairment, then that gets you that separate rating. Like I know we've talked about it in other videos, like a 70% rating is occupational and social impairment or deficiencies in most areas, or like a 50% rating is reduced reliability and productivity. So, right, if it, like you mentioned, if that specific symptom is a diagnosis that leads to that severity or that impairment or deficiency, that makes it entitled to its own
And
rating.
so I think I'm kind of stretching this out further, and I know this is already so complicated, but I think it's helpful to also think, so if you have a diagnosis of TBI, but the only measurable residual, and I might not be using the right words, but if the only issues you're having because of the TBI are mental health related, you're not necessarily going to get a base rating for TBI just because you have the diagnosis and then a whole separate rating? Or is there a base?
So it's going to depend on what the doctor finds, because the symptoms like, difficulty communicating or remembering things, that may be
Right.
a symptom of the TBI, while the depression has its own separate symptoms. So, it's going to be for the doctor to determine. So like if those cognitive symptoms still warrant, the 1 or the 2, you might still get a 10% rating for TBI and then the separate rating for
if you can
the mental.
have a doctor separate out.
Exactly.
It gets tricky.
It really is, yes. But ultimately, there's always IU, individual unemployability. So, you have all these different ratings, and let's say they don't, it's not a one rating of 100%, or it's not a combined 100%. You still have unemployability. So if you can't work because of your TBI, because of these residuals, remember, I know we've talked about it in other videos, how to qualify for TBI. how to qualify for IU. You have either one rating of 60% or a combined rating of 70, with at least one of them being 40. Keep in mind that if you are rated for different residuals, but they all stem from TBI, that counts as one condition. So if you have a 60% for lots of different things, but they all come from the TBI, that's one condition. You can qualify for IU that way.
That's a great thing to point out, because it is, you have so many different things, but it looks like you have, 8 different disabilities, but at the end of the day, it's just one. And even if, meeting those rating requirements makes it a lot more straightforward, but at the end of the day, if you have TBI and it's related to service, can't work because of it. And so with all of that, if we haven't thoroughly confused everyone enough or made it more complex, there is with TBI, it's, as we keep saying, there's not only so many areas for it to cause problems, and it can really become a severely disabling condition or lead to severely disabling problems. And so another thing, if you need another thing to think about when looking at your rating, even if you're 100%, if you have TBI, that's definitely a situation where you need to pay attention to what's called special monthly compensation, SMC. Explain, there's a wide range of SMC, and we could probably talk about that for another 2 hours. But there is SMC available just for TBI.
Yeah. And so depending again on your residuals of TBI, you might qualify for different types of SMC, because there's like loss of use and just, lots of different types. One of the main ones you'll want to consider is aid and attendance. So if you are in need of regular aid and attendance from another person to perform your functions of daily living. So the things they're going to look at is, are you able to dress yourself? Are you able to keep yourself clean and presentable? Are you able to feed yourself, attend to the wants of nature, protect yourself from hazards or dangers of daily environment? So one of the most common things I hear from veterans with TBI is they tend to leave the stove on. So they can't cook because they might leave the stove on, and that's happened before. Or, doing anything around the house, they need supervision. And so they're not able to, kind of watch out for the dangers of daily life. And that's due to those cognitive functions of TBI. So if you need someone to help you with all of these activities, that warrants aid and attendance.
That's a good example, because I think the way that the VA phrases it a lot is, oh, can you cook for yourself? And if you think, okay, yes, physically I can go into the kitchen and make a meal, that's not the end of it. Because if you then leave the kitchen and leave the stove on and other things, you can't cook a meal without possibly burning down the house, then you can't really.
Yeah, exactly. And so the 100% rating gets you a monthly amount of $3,106.04. If you're awarded special monthly compensation for aid and attendance, it's actually going to be $3,864.90. Now, the highest level of special monthly compensation that you can get, there's one specifically for TBI. It's called SMCT, TBI, I guess. That might make it easy to remember. But so if you require this aid and attendance, all these things that we just mentioned, but if it's severe enough to the point where if you didn't have somebody there helping you every day, you would require hospitalization, nursing home care, or other residential institutional care, that would warrant this award of SMCT. And the monthly amount that you would get is $8,889.08.
And that's in total, correct? So that's not on top of, okay.
Yeah, exactly. That's the total amount that you would receive. But I mean, that's a lot of money. And unfortunately, this is for those severe cases where, if a veteran didn't have that help every day, they would have to be hospitalized or in a nursing home. But if that is the case, if you have your wife there, or if you have, a nurse coming in and basically you can't be left alone, even if you're able to, physically function and walk around, but you lack that mental capacity to take care of yourself, again, if it's severe enough, you can get that extra compensation.
Like remembering medication.
Yes,
exactly. Which is hard enough to do when you don't have, remembering to take a vitamin every day. And so medication is another one where not only am I someone there to say, hey, did you take this?
Yeah, I had a veteran that, if the wife didn't, sit there with him and watch him take the medication, he might take 2 of medication in the same day, or, just like say that he took it and think he took it, but he forgot to take it. And so then that leads to, all kinds of physical problems and things like that.
Right. Which it's, with TBI, I think some of the most recognizable things are the cognitive problems and the mood problems. But, if you're not taking medication for something, and that can lead to various physical problems also. And that's where, just adding into, it's so detailed and so many layers that are involved issues.
Yeah. But again, because there's so much that you can get as far as benefits and the monthly amount, it's worth looking into how all of your symptoms combine to entitle you to that.
Yeah, you're talking a difference of, get to individual unemployability, which in so many cases is, the ultimate goal, getting you 100%. We're talking about a difference of about $5,000 a month.
Yeah.
And so that's where, it's definitely worth looking even into it on your own or reaching out to a lawyer, because if the worst case scenario, they'll say, it doesn't look like it's something we can prove, but best case scenario, that can drastically change your way of life. Yeah.
Can you think of any cases that you've had, specifically in regards to TBI, how it came about, things like that?
There was an interesting case. So when I was looking at kind of some of the typical examples of what might happen in service, the IED blast, things like that, I remembered a case that I worked on where the veteran was actually a boxer in service. And so we didn't have a lot of service records. So obviously, not service medical records or things like that, but we did find, I want to say it was a newspaper article. I'm not sure if it was, like the military branch's newspaper or, local newspaper, but it talked about that veteran being in a boxing match, getting knocked out. And that not only established what happened in service, but a doctor can kind of retroactively look back on that and say, well, here's, in this type of injury, here's what usually would happen. And at the end of the day, it's for everything you have to prove, it's at least as likely as not. You don't have to prove that it's 100% sure that the veteran, lost consciousness for this amount of time. But having a doctor say, well, with a boxer being involved in this kind of fight, it's most likely that it resulted in this level of, severity. And so that was one of the very where it's kind of an out of the ordinary, but you just don't really think of, it's another leisure activity. You think of TBIs as IED blast, things like that, being in combat, but boxing.
Yeah. One case I had, it was a veteran whose husband beat her. And so, a lot of times a physical assault, that counts as a blow to the head. And so, she got a restraining order against him. We were kind of able to use that to prove that the beatings caused TBI. And so, things that you normally just wouldn't think of. It doesn't have to be that explosion or car accident.
Right. And that wasn't even, just because her husband wasn't in the military. I don't know if he was, but regardless, if she was domestic violence happened while she was on active duty, then it counts as an in-service incident. We could go on forever, but we won't. So I think overall, to tie it all together, some common issues or even just the theme of TBI claims, the biggest one being getting the right rate. I think proving service connection, while it is the first thing you have to do, it's first battle to win. I don't usually see that necessarily being any more complicated than proving service connection for other conditions. I know a lot of times there might not be service records, especially if it's a combat-related injury. But that's not necessarily, in my opinion, kind of a TBI-related issue. But I think the issues with TBI really come in after you get service-connected and you're trying to get those ratings.
Yeah, trying to get everything that you're entitled to. And that's something that, we will always look for, going through all of the symptoms, making sure that you are getting everything you're entitled to.
It's something that when things are left open to interpretation, like saying occasionally or usually, it gives you room to argue, but it also gives a room for you to get lowballed on ratings or not have the separate rating. Pay attention to that. Information on it on written blogs and other ththings. So thanks for joining. Thanks for answering my random questions, Melanie.
And
talking through this. Even though it's something that I do also, you kind of hearing it in a different way. I learned things too. So
awesome. Yeah.
Thanks for joining us, everyone. And tune in for other VA video blogs from Hill and Ponton. Thanks.